coming to our favorite part of this event, the Humanitarian Awards, and afterwards our amazing musical guest, and a chance to have dessert. I think that someone said to me I should repeat this over and over again. The theme of this event has got to be doubling down, right? Are we all going to double down? So let's recognize some folks who have been doubling down for a while. I want to tell you, selecting who gets the Humanitarian Award is very difficult because we have such amazing, amazing humans around us with amazing empathy and courage and work. So what we try to do is ask ourselves, in the year that went by, who did the most to push patient safety forward? Who did the most to get us closer to zero preventable deaths? And as I mentioned during my panel, the panel on assertiveness, there's one institution and one group of people that just have amazed me, because I have had the wonderful opportunity to visit a lot of wonderful institutions, and I just was amazed at the level of collegialness of the team, the way they focus on the patients. But given that they're from Vermont, I do wonder if I was part of that Chevy Chase movie. What was it called? Funny Farm? Where they were trying to sell them real estate, so they all acted really good for a while. Yes, and then they move in and the crazies come out. But Eileen, who's the new CEO, has assured me they've kept that up for 30 days at least. So I think it's real. But putting aside what we witnessed is what they accomplished. To get to zero is very difficult. Very difficult. And I know it's what we put out there. And I know as we get closer to that number, we're going to be going up and down on it, and it's going to be hard landing. But they've shown that it can be done. And there's a lot of incredible people in this institution. But everybody says two words: Anna, Noonan. And please, would you come up first? Please come on up. And Eileen, as CEO of the hospital, please, would you come up? So, Anna, thank you.
Very kind, thank you.
Thank you, thank you. Please.
Thank you so much. I really look forward to working with you.
Thank you, thank you.
It's called doubling up.
Doubling up, doubling up. So, Anna, would you like to say a few words? We have a little mic. I know you're not shy, so please.
Well, I'm going to keep it short and sweet. I want to thank, first and foremost, the leaders of our organization and the team, many of whom are here tonight. Little feedback there.
Yes.
Again, it's really about the whole organization. And so Eileen and I are just here representing the power of many. We're fortunate to have a very committed and driven group of individuals that for them zero is achievable, and they want to make it happen. So we want to be part of this journey. And so thank you very much for the honor. We appreciate the privilege, and again, thank you to the team out there that make it happen every day. So thanks very much.
Thank you.
So I have to tell you that, truthfully, I've been 30 days in Vermont, and it is the most incredible gig of my life. So I've just taken on as the president at University of Vermont Medical Center. And who would know that the first thing I get to do is to come and be part of this incredible evening. What's really impressive to me is what I've witnessed over the last 2 days. So I had the opportunity this morning to really think about leadership, to think about leadership in a different way, to have President Clinton, to have Joe Biden come and talk. This morning I said to my husband, if there's a leader in this room who didn't walk away realizing that this is the most important thing we can do in the United States, they're nuts. They have no reason to be in a leadership position. That's the power of this group. That's the power of this group. So this is called managing it up. This is called doubling it up, not doubling it down. It's
Doubling
doubling
it
it up. And it's been a really incredible experience. I'm really proud to be part of this organization, and thank you so much for recognizing the work of the team at University of Vermont Medical Center. Thank you.
Thank you. Can we get a picture? Yeah, can we get a group? Thank you. You want to go in the middle?
It's yours.
Thank you.
Thank you. And you get one too. Thank you. That's your personal one.
Oh my goodness. Thank you.
Thank you so much. Thank you.
Thank you so much. What a great opportunity.
Oh, keep
Appreciate
leading
it.
Keep leading the way. Thank you. Thank you, Eileen.
So much.
Thank you. Thank you so much. Okay, well, our next Humanitarian Award winner is a gentleman that leads a group of about 100,000 plus respiratory therapists across the world. And after coming last year to the summit, he went back and he took the message to every respiratory therapist and urged them to commit to zero, urged them to commit themselves to patient safety. And we're so grateful for what you've done. You've touched so many people. We hear about your work. And many hospitals have come forward because of the work you've done and because of your respiratory therapist. So Tom Kallstrom, please come on up. Thank you so much. Tom, would you like to say?
Joe said I could have a half an hour.
An hour.
I just want to thank you. I'm not deserving of this award, but the 175 respiratory therapists that are practicing in this country
175,000. Wow.
and around the world, actually,
Wow.
thank you for this award and this recognition. You know, every year there's about 300,000 people that are on a ventilator. And there are still a lot of things we need to do to improve patient care. On an annual basis, between 300 and 500 patients die because of an alarm associated death with their ventilator. And I think these are one of the things that we need to work together on as we move forward to next year and the years beyond. So again, I thank you for this recognition of our great profession and our respiratory therapist. And with that, I'll just give it back to you. Thank you. I had a chance to meet the Vice President today, and it was really an honor. I happened to bring a birthday card because my grandson turns 2 today. And I said, would you mind signing this card for me? And he did, but he said, I'll do something even better. He said, give me your phone. And so I called my daughter. And thankfully, she didn't answer the phone, so he left a message wishing my grandson a happy birthday. So that was pretty cool. That was pretty cool.
Thank you so much. Can we take a picture together? Thank you.
Go over here.
Great.
What is that?